Okay, I am Stephen Marcus, MD, and I am the professor of emergency medicine and associate professor of pediatrics, and my role is the medical director of the New Jersey Poison Information Education System at the New Jersey Medical School of Rutgers University. The New Jersey Poison Center actually has several major goals. One is what the public sees, and that's the Poison Center. That's the 24 hours a day, 7 days a week hotline for information for providers of care, for the public, anybody that has a question that they may have been exposed to a poison or any potentially toxic substance. The calls about lead poisoning, I can't really call it a spike. I think one of the sad things that have happened that I've seen over the last 33 years of the existence of the regional center here in Newark is that with each new public health problem that's come out there, the response has decreased. So there's kind of an apathy. And even the comedians, when you talk about lead just recently, and I don't remember, it's Comedy Central or something or other, I saw the YouTube version of it. One of the comedians went on air and joked about lead poisoning, and joked about some of the things that I was involved with lead poisoning with Sesame Street in the 1990s. The public just gets numb and doesn't respond at all. Well, I'm fatigued from discussing lead, to be sure. But no, I mean, it just didn't, for reasons that I don't understand, it really didn't raise as much public furor as it probably should have. I honestly think that Newark, as an older city, may have a little bit bigger problem, but the lead problem, particularly what we're talking, if you're talking about the lead in the water, this is a societal problem across the country, probably across the world, that has been one thing that has been little understood and really not addressed until the Flint, Michigan thing occurred. And to be honest, lead was the minor problem in Flint. I mean, there are at least 12 or 13 people that have died already from Legionella disease in that area, which is way above what should be. But people were complaining that their skin burned from the water. They were losing hair. That doesn't happen from the contact with lead in the water. Lead is a very protein, we call it poison, P-R-O-T-E-A-N. It disturbs the way the body makes heme in hemoglobin. Heme is required for all metabolism throughout the body. So any disturbance in the body's ability to manufacture heme is devastating. And lead does just that. The reason we worry about children is they're undergoing the rapidest development at around, a year to 3 to 4 years of age. Their brain is developing extremely rapidly. All of that happens in the same period of time where children explore their environment so much. They're putting things into their mouth and getting exposed to lead from the classic exposures that we used to talk about. And that was paint and dust and dirt and that kind of stuff. But also those children, remember, many children are on formula, and that formula is made by powder that's diluted with water. So that children are in a very, very vulnerable, it's almost a perfect storm, if we can use that analogy. That kids, when their brains are undergoing the greatest development, are doing all the things that make them more exposed to lead. So that's why we're worried about that. I'm not saying that the cause of the decline and fall of our modern society is all due to lead, but there certainly are circumstantial evidence. Let's put it that way. I don't want to be Chicken Little, though, and say that the society is being destroyed because of lead, but there's enough room to worry about that. We don't know. And EPA chose a particular concentration as their point at which intervention must occur. That doesn't say that they establish a level that should not be exceeded as far as dose. And there's a big difference between those two, and I don't know why the EPA did not choose to establish a dose. They don't go in and collect the samples, but generally speaking, a sample is obtained by somebody. Often the person that lives in a house or an apartment or what have you. That water is supposed to be obtained after at least the 6-hour dwell time, because a lot of the lead contamination in water is from pipes that the water's been sitting in. Nobody supervises the person collecting that, so we don't know whether it's collected correctly or not. The EPA allows, depending on how many specimens are collected, depends on how big the population of the community is, they accept 10% to be above even their standard. Well, think about what that means. Yes, that means that 90% of the water is safe, but that also means that 10% of the water might not be safe. So you take a drink of water, you got a 1 in 10 chance of being exposed to lead. That to me is crazy. Up until the Flint, I must tell you, I was deluded into believing that the water was safe, that you were better off drinking water from the tap than from a bottle because there were more laws concerning what was coming out of your tap. I no longer say that. I now say to my patients, if you're worried, install a filter or drink bottled water. Particularly the patients that I see, because these are people that are defined as having lead. Okay, so these are children or adults that have lead poisoning, and we're trying to get rid of their lead, and the number one treatment of lead poisoning is to eliminate the source. I'm now telling the families, you can go out and buy a filter. There are several different ways to install the filter. You can install it on a faucet where it's on the end of the faucet, so even any lead that may be in the faucet itself gets picked up by the filter. You can buy an under-counter filter that has cartridges that need to be changed. You can use one of these gizmos that sits on the countertop and you pour the water into, and the filter is built in. If you use a filter that is certified by the National Science Foundation as being capable of removing lead, then you can feel comfortable to some extent that you're dropping the lead in the water that you're drinking. At a concentration of 15 parts per billion in a child of 2 years of age, you already have a lead level predicted of 3. Now, years ago, 3 wouldn't concern us, but when you put together all the international studies on the effect of lead on developing children, by the time a child has got a lead level of 3 or more, or even 1, there's already demonstrable changes globally in IQ. That doesn't mean in an individual child, but when you look at all the studies and look at large numbers of children, that by the time the lead level reaches the CDC reference level of 5, there's already damage done.